Last Tuesday at 3:47 a.m. My phone exploded with the kind of call that changes everything. Dr. Chen. We need you now. Eleanor Thompson. 74 years old. Massive stroke. When I raced to the hospital and saw Eleanor's brain scan, my blood ran cold. But what haunts me isn't just what I saw on that screen, it's what Eleanor's daughter told me next. Doctor. For 3 weeks. Mom kept saying she had weird headaches and felt tired. We thought she was just getting old. How could we have missed this? That question shattered something inside me. Because Eleanor's family didn't miss anything. They were speaking stroke's secret language perfectly, they just didn't know how to translate it. I'm Dr. Chen. And for 25 years, I've been fighting strokes in the emergency room. I've watched thousands of families destroy themselves with guilt over missing the signs when the truth is, we've all been looking for the wrong signs entirely. Today, I'm going to teach you the 10 warning signs that 90% of seniors dismiss as just getting old, signs that could save your life or someone you love. Every 40 seconds, someone in America has a stroke. While you're watching this video, at least 4 people will have their lives shattered. But here's what will shock you: 80% of strokes are completely preventable if you know what to look for. The problem? We've been taught to wait for the dramatic collapse, the obvious slurred speech. Meanwhile, stroke is whispering its intentions weeks, sometimes months in advance. The first warning sign that almost everyone misses is what I call the different headache. Robert was a 71-year-old construction worker who bragged he'd never called in sick. For 2 weeks, Robert experienced headaches he described as not normal. Not your typical stress headache, these felt like someone was squeezing his brain from the inside. His wife begged him to see a doctor, but Robert took aspirin and figured it would pass. These headaches would come and go, always feeling wrong in a way Robert couldn't explain. They were sudden, severe, often like being struck by lightning. They came with nausea and vomiting, and a feeling that something was seriously wrong. 2 weeks later, his wife found him unconscious on the bathroom floor. The stroke had damaged so much of his brain that Robert never walked again. Seniors dismiss these headaches as blood pressure changes or weather patterns. But if a headache feels different from anything you've experienced before, don't wait. The second sign is dizziness that won't quit. Harold, 82 years old, started having what he called wobbly moments. Episodes where he'd feel off balance and grab the kitchen counter. Not dramatic room-spinning vertigo, just enough to make him pause. His wife Margaret kept saying, "Harold, you should see the doctor." But Harold brushed it off. "I'm just getting old." Maggi. Those wobbly moments weren't aging, they were Harold's brain's balance center being starved of blood. Each episode was a warning that his blood vessels were narrowing. This type of dizziness lasts longer than 5 minutes and makes you feel unsteady on your feet. It's often dismissed as inner ear problems or medication side effects. 3 weeks later, during one of his wobbly moments, Harold collapsed. The stroke that followed left him unable to recognize his own wife. The third warning sign is vision changes. You blame on aging. Dorothy, a 79-year-old, retired teacher, loved reading 3 books a week. She started having trouble focusing on words. Letters seemed to dance on the page. Sometimes she'd see double. Her daughter suggested new glasses. So, Dorothy visited her optometrist. The eye doctor found nothing wrong. 2 weeks later, Dorothy was reading when she suddenly couldn't see the left half of the page. She blinked, rubbed her eyes, but half the page remained invisible. The stroke that followed stole her ability to read forever. Vision changes that signal stroke include sudden blurred vision, double vision, or temporary vision loss in one or both eyes. These aren't about needing new glasses, they happen suddenly and don't improve with blinking or changing positions. The fourth sign is when your face feels funny. Patricia, 68 years old, noticed her smile felt crooked in the mirror. Her family couldn't see anything different. So Patricia convinced herself she was imagining things. Then she started having trouble chewing, one side of her mouth wasn't working quite right. She began cutting food into smaller pieces, thinking it was just being careful. 2 weeks later, Patricia's subtle facial changes became unmistakably dramatic when a massive stroke left her entire right side paralyzed. Facial numbness or weakness, especially on one side, often starts subtly. Your face might feel slightly numb, like after dental anesthesia. Or your smile might feel different. You might have trouble controlling muscles on one side of your face. Don't wait for obvious drooping, subtle changes matter. The fifth warning sign is when words get tangled. George started having what his wife called word salad episodes. He'd be talking normally, then suddenly mix up words or say things that didn't make sense. These episodes lasted just minutes. Then George would be back to normal. His family joked about senior moments. But these weren't senior moments, they were mini strokes affecting George's speech centers. Speech difficulties that signal stroke include sudden slurring, trouble getting words out, or saying things that don't make sense. The key is sudden onset and the fact that it represents a change from normal speech patterns, even if it seems to improve. Sudden speech changes are medical emergencies. Each episode George experienced was warning of a bigger stroke to come. The sixth sign is one-sided weakness that starts small. Maria, 71 years old, noticed her left hand wasn't working right when buttoning her blouse. She couldn't grip buttons properly. Her hand felt clumsy. Maria blamed arthritis and figured it would improve. Over the next few days, the weakness spread up her arm. By the time Maria's daughter insisted she see a doctor, the weakness had affected her entire left side. Maria had been having small strokes that could have been stopped if the early weakness had been recognized. Stroke-related weakness has a specific pattern. It affects one entire side of the body and comes on suddenly. It might start subtle, maybe you can't grip things as tightly, or one leg feels heavy. Any sudden onset of one-sided weakness should be taken seriously. The seventh warning sign is sudden confusion that appears overnight. Anna, 83 years old, was brought to our emergency room by her son. For 3 days, Anna had been increasingly confused. She didn't recognize her own neighborhood during their usual drive. She kept asking where she was, even sitting in her own living room. Anna's son thought she was developing dementia, but her confusion had appeared almost overnight. Anna wasn't developing dementia, she was having small strokes affecting her memory and orientation. Stroke-related confusion happens much more quickly than dementia, which develops gradually over months or years. If someone suddenly becomes more confused than usual, doesn't recognize familiar places or people, or seems lost in environments they know well, this could be stroke affecting their brain. The eighth sign is exhaustion that doesn't make sense. James, 77 years old, had always been energetic. Suddenly, he couldn't muster energy for things he loved. Gardening, walking with his wife, even getting dressed felt exhausting. His family thought he might be depressed, especially after losing a close friend. But James wasn't depressed. His brain wasn't getting enough oxygen-rich blood, causing overwhelming fatigue that rest couldn't fix. Stroke-related fatigue is different from normal tiredness. It's profound exhaustion that makes simple tasks feel impossible, accompanied by apathy about activities that used to matter. If someone normally active suddenly becomes exhausted and disinterested, especially if this happens over days, rather than months. It could signal poor brain blood flow. The 9th warning sign is nausea without explanation. Betty, 69 years old, started experiencing episodes of nausea and vomiting that seemed to come from nowhere. Not related to food. Not like stomach flu, just sudden, unexplained nausea that would last for hours. Betty blamed stress and took antacids. 3 weeks later, Betty collapsed during what started as another stomach episode. The stroke that followed left her unable to swallow safely ever again. Unexplained nausea and vomiting, especially when it's not related to food or illness, can be an early stroke warning. The nausea often comes with headaches or dizziness and doesn't respond to typical stomach remedies. The 10th and final warning sign is personality changes you dismiss as normal aging. Frank, 74 years old, started becoming unusually irritable and impatient. This calm gentleman began snapping at his wife over small things, becoming frustrated with tasks that never bothered him before. His family figured he was just getting cranky with age. But Frank's personality changes weren't about getting older, they were stroke affecting the areas of his brain that control mood and behavior. The stroke that came 6 weeks later left Frank unable to control his emotions at all. Sudden personality changes like increased irritability, mood swings, loss of empathy, or inappropriate behavior can signal stroke affecting emotional control centers. Now here's what you must do if you suspect someone is having a stroke. Use the FAST test. F stands for face, ask them to smile and check if one side droops. A stands for arms, ask them to raise both arms and see if one drifts down. S stands for speech, ask them to repeat a simple phrase and listen for slurring or strange words. T stands for time, if you see any of these signs, call 911 immediately. There are critical things you must never do. Don't give water, food, or medications. Don't massage or try acupuncture. Don't move the person unless absolutely necessary. Don't wait to see if it gets better. Every minute matters because brain cells are dying. Here's the truth that could save a life. Time is brain. Every minute during a stroke. 9 million brain cells D. The difference between recognizing these early warnings and missing them isn't just recovery versus disability, it's often life versus death. These 10 signs I've shared aren't just medical symptoms, they're your loved one's brain crying for help in the only language it knows. Don't let anyone dismiss these as normal aging. Trust your instincts. Trust what you're seeing. And act immediately. If you recognize any of these signs in yourself or someone you love, call 911 right now. Don't wait for more symptoms. Don't convince yourself it's nothing. Every second counts. Please save this video and share it with everyone you know over 60. Share it with their children. Share it with their caregivers. Because somewhere right now, someone you could help is displaying these exact warning signs. And their family thinks they're just getting old. The 10 signs I've shared today could literally save a life. Maybe even your own. Don't let another Eleanor, another Harold, another Dorothy suffer because no one knew how to hear what their brain was trying to say. Remember, stroke doesn't just happen to other people. It's hunting all of us. But now you speak its language. Use that knowledge. Save a life.